Uh, Good afternoon, respected guests and dignitaries. My- Chalat nahi hai? Okay. Okay. Good afternoon, everyone. Um, my presentation is about sanitation. I've been in this space for the last 15 years, and I consider myself a sanitation professional. And I've coined this terminology called sanipreneur. So I like to call myself a sanipreneur. Most people would look at it as a shit man or a loo man or whatever, but I like to call myself a sanipreneur. We have developed successful models, and I'm quickly going to show you what we've been doing and what exactly we need in time. So we are basically India's pioneer and award-winning sanitation services and solutions provider. We've been a specialist. We started with portable sanitation, where now we're in waste management services and developing lots of solutions and models for toilets and waste management way before our Honorable Prime Minister came out with this idea of Swachh Bharat. We've developed already several pilot projects as well as successful models pan-India. We're offering so we believe in a model which is not only a sale model but even an annuity model. So it's at a lower cost, and you can take advantage of it at a much better price, especially for the BOP. We are catering and servicing to the bottom of the pyramid and the unserved settlements in urban India, so as rural and urban India, uh, resulting in an improved a situation of improved hygiene, enterprise building, and dignity to all, which is extremely important in today's day and age. We provide all kinds of toilets, which include portable toilets, public toilets, community, school sanitation, and we're also doing waste management and biodigesters as well. I think the image is a little okay. So the first one is a low-cost ferrocement unit which we've developed, which is a micro-enterprise model which can go out to rural areas where we provide a mold and certain components, and locally can be made for less than 10 to 12,000 rupees. The next one is a portable toilet, which we offer on an annuity basis for all the big yatras and melas. We recently did the Kumbh Mela, where we provided 4,000 toilets, and with cleaning, servicing, evacuation, disposal. And our next step is going to be treatment of the waste and generation of energy from that. We do school sanitation project, public toilets. The one on Ferguson College Road, right on the corner next to the Ranade Institute, you can see a toilet with Varli art on it opposite Rupali. It's been maintained by us. It's the only toilet in Pune which you can check, has no smell, and you can use it at any time, especially it's only for women. But it's well maintained and managed by a woman entrepreneur as well. We also have developed, in the process of developing something like Uber, and I call it Suber, which is a sewage application, and it's basically aggregating sewage trucks and waste management trucks, and so if somebody wants to evacuate their septic tank in their house, they can just go on a Suber app and they can order a truck to come and clean their septic. Uh, the next step that I'm going to talk about quickly is the partnerships that we developed. So we've developed a partnership, and this is a quick case study I'm going to talk about, which is developed with the Pune International Center, Rural Relations, Quiz College Foundation, Symbiosis Society, and executed by 3S, which is our brand of sanitation services. So the first step was we, along with Dr. Mashelkar and Dr. Padgaonkar, I helped them develop the sanitation policy, which many of you must have seen, and presented it to the Honorable Rural Minister and the Sanitation Minister of India in the month of August and September, around that time. Post that, what we did was, our plan was to reach out to 22 villages in this area around Symbiosis. So Symbiosis came up and said we'll do 22 villages where we'll provide all kinds of solutions related to the sanitation aspect. So along with rural relations, we got all their Wikipedia information and everything, and then we decided on zeroing on one village. And in the month of October, we finalized one village, one area where we decided to change the school toilet. This is what you can see is what it was, and this is what we transformed it into in November. This took us not even 15 days, even less than that, to transform it. But as you can see, the toilet is colorful, it's attractive, and it makes people actually use them. Because our concept is that the more attractive a toilet is, the nicer it looks, people will keep it clean and also use it. So the plan is to cover 8 villages by 31st of December, to cover 22 villages by 31st of March, which is the end of the financial year. And we've already developed a sustainability model where the children of the school itself have come up and they clean the toilets. So we're going to reduce the cost of maintenance by that. This is a very commonly practiced concept pan-Asia, especially in Japan, which is one of the cleanest places today in the world that you can think about. And we're going to use communication channels, which is going to be assisted by the Symbiosis Institute for behavioral and social changes locally. So educate them on menstruation, on health and hygiene issues and things like that. I did discuss the app. We're developing another app which could be used for monitoring the progress of this particular activity that we're doing. That could also be used by the ministry, or the people who are in senior leadership can actually see the changes on a regular level. Oops, what was that? Okay. And the last step is that all this is possible, but we need funding, and corporate social responsibility is a big area where we're looking at getting funds from to get this done. So the 22 villages, and then make a plan, make a absolute concrete report, and submit it to the Honorable Minister and to the senior Swachh Bharat Abhiyan committee to see how we can actually scale this up pan-India. That's really the aim of this entire exercise that we're doing along with PIC. The other aspect which you can't see in the presentation is microfinance, is also another area which we want to tap into for the purchase and for the requirement of utilizing this entire concept. I would sum it up with that although we take it for granted, sanitation is a physical measure that has probably done more to increase human life than any kind of drug or surgery. This was said by Dr. Deepak Chopra recently. Thank you very much.